This video is about vaginal tumor type because different MCQs comes related to this topic as well. Although it's a rare topic, but exam question might come from this topic as well. So coming to the exam question was that a 2 years old girl presented with a vaginal bleeding and mass. Most common cancer would be, there were different options like rhabdomyosarcoma, endodermal sinus tumor, endometrioid cancer, basal cell carcinoma, and clear cell carcinoma. So the different types of vaginal cancer are written in due hertz in a nice way. Ninth edition, page 852. Okay, so let us discuss sarcoma. Sarcoma of vagina. This is a vaginal tumor, and leiomyosarcoma are most frequently diagnosed, with other types reported, including adenocarcinoma and angiocarcinoma. Primary therapy is surgical, involving wide local excision of the tumor with a free margin. Adjuvant radiotherapy has been educated for the high-grade tumors or in recurrent disease, and adjuvant chemotherapy has been utilized by some, but has not been shown to confer a survival advantage in soft tissue sarcoma of extremities, and the majority of the women presents with discomfort or bleeding. Second type is rhabdomyosarcoma, which is sarcoma bourgeoides. It accounts for less than 2% of the vaginal sarcoma. It is the most common soft tissue tumor in the genitourinary tract during childhood, and about 90% of the cases occurs in childhood under 3 years of the age, and almost 2 out of 3 occurs in the first 2 years of the life, although rare cases are reported in older women. Presentation is classically with vaginal mass composed of soft grape-like vesicle, but other may present with vaginal bleeding, discharge, a single small polyp, or occasionally a black hemorrhagic mass. Now, the treatment involves conservative surgery, which is aimed at preserving the function of the female pelvic organ, but depends largely on the combination of the chemotherapy using vincristine, actinomycin D, and cyclophosphamide. Adjuvant surgery radiotherapy might be added. Next come clear cell carcinoma, which consists of solid sheet of the clear cells or tubules and cyst lined by hobnail cells. And the median age at diagnosis is 19 years. So in young age, this is not common, although the range is 7 to 42. And approximately 61% of the patients have documented exposure of DES, which is diethylstilbestrol, or to a chemically related non-steroidal estrogen in utero. Although the risk of developing clear cell adenocarcinoma following exposure to such drug in utero was thought to be considerable, it is now appreciated that the risks are in fact very low. Okay, so you have to remember that it is caused by DES exposure. Treatment is by radical surgery or radiotherapy. Next comes melanoma. Primary malignant melanoma of vagina is an aggressive and rare gynecological malignancies. Fewer than 200 cases have been reported worldwide to date, but it is known that this disease has the worst prognosis of all gynecological malignancies. Okay, so worst prognosis of all gynecological malignancies is carried by melanoma. Malignant melanoma of the vagina is 104 less common than melanoma of the non-genital skin. Now, what would be the treatment? As with the squamous vaginal carcinoma, the choice of the treatment lies between the surgery, radiotherapy, or combined approach. In the end, we will discuss endodermal sinus tumor. Endodermal sinus tumor, which more commonly arise in the ovary or testes of the infant, are also recognized in the vaginas of young girls. Approximately 50 cases have been reported with no patients aged over 3 years. Presentation will usually follow an episode of vaginal bleeding or discharge in the young girl, who at examination is found to have friable polyviral exophytic tumor. Now, immunohistochemistry will reveal positive staining for alpha-fetoprotein, and in some cases serum alpha-fetoprotein levels are elevated. Now, the emphasis for treatment has moved toward limited excisional surgery combined with the preoperative or postoperative chemotherapy. Multi-agent chemotherapy is employed and is the same as that used for the successful treatment of ovarian endodermal sinus tumors. Now, coming to the exam questions, as we read all of the types, so the most probable answer would that be A, rhabdomyosarcoma. Okay, thank you.